Greetings. I'm Elizabeth Asige, a physiotherapist and a PhD student in Kampala, Uganda. I coordinated and managed the Akwenda Intervention Program in the field.
And I'm Gillian Saloojee, physiotherapist from Johannesburg, South Africa. I assisted in designing the Akwenda Intervention Program, and I was responsible for training and mentoring the therapists who actually implemented the intervention.
Akwenda Intervention Program is part of the curious study that started in 2015, in which the population-based cohort of children and youth with cerebral palsy in a rural resource-constrained district of Uganda were identified. Since then, we have followed and studied their development, which is described in many papers. This final study is to evaluate the Akwenda Intervention Program in a randomized controlled trial. Akwenda intervention was carried out in Iganga Maige Health Demographic Study with 100 children and youth with cerebral palsy and their primary caregivers. The groups were clustered into two geographically identical groups, similar in age, sex, and GFMC levels. The outcome measures were GFM 66 and Paediatric Uganda. Akwenda intervention is a multi-component intervention with 5 components. We have caregiver-led workshops that was delivered by the primary caregivers themselves, primary caregivers of children with cerebral palsy. The therapist led practical group session, technical assistive device provision, goal setting, in which the caregivers set 3 goals for their child, and the 4th goal for the child that received the technical assistive device. Communication and advocacy delivered by the social worker had 5 workshops for the caregiver, 1 workshop for the community stakeholders that included church leaders, civil servants, community leaders, and so on. And then we had 1 joint dialogue. The intervention was implemented in 12 months, as indicated with the implementation graph. In yellow, the caregiver-led workshops. In orange, the therapist-led practical group session. Assistive devices were delivered to the children the 6th month after the training of the caregivers on use and maintenance, and the 7th month. Communication and advocacy in red. The goal setting was done in 8th month and 9th month. And in total, the caregivers received 56 hours of input.
Our results demonstrate conclusively that the Akwenda Intervention Program had a broad and large impact on daily functioning. Interestingly and importantly, the intervention was effective across all ages. Participants were aged 2 to 23 and across all GMFCS levels. The greatest impact was on the caregiver assistance scales, in particular, the caregiver assistant social scale and the caregiver assistant self-care scale, while it was smaller on the mobility and motor function scales. So in summary, the participants needed less assistance and became more independent. Elizabeth, as you've described, the intervention was multi-component. There were 5 elements to it. But how would you describe what contributed to the results that we see?
Dr. Gillian, The intervention had training component that provided knowledge, which was powerful to the caregivers, stakeholders, the children large. There was changing attitude of the caregivers towards their children that was recognized by the children, and this made the children own the workshop and encourage even the caregivers that were in the beginning sluggish to attend the workshops. So I think the knowledge that was delivered through the training was so powerful that it changed attitude of the caregiver, the stakeholders, and empowered the caregivers, the children, the stakeholders. And that resulted into what we have seen from the intervention, the positive change.
In other words, the training that the parents received, both through the caregiver-led workshops and that was reinforced in the therapist-led practical sessions, that training and knowledge about their child helped to raise expectations that parents had for their children, change their attitudes, and also in so doing that, alongside that, it was as the parents' attitudes towards their children changed, the children realized more it was expected of them and they could actually do more. Would you agree with that, Elizabeth?
Yes, understanding of the condition and acceptance of the children was all from the knowledge acquired.
Thank you, Elizabeth.
Thank you.
And thank you for watching this podcast. If you'd like to know more, please go to our article, which also contains a detailed description of the intervention itself, which, as you can see, was quite complex, but that's clearly described in the supplement. Thank you.
Welcome. Thank you.